Now we see the histological slide of the trachea. So as here we can see that the lining epithelium is pseudostratified columnar epithelium ciliated. See, I'm zooming it. This is not so clearly visible, but little bit there the pseudostratified columnar epithelium, and this glassy appearance is due to the hyaline cartilage. And there is a muscle layer also present, trachealis muscle. And this is the histology of the trachea. Now we look for the histological diagram of the lung. Histological diagram of the lung, we can see mainly three parts of the respiratory tract, that is interpulmonary bronchus, terminal bronchus, and terminal bronchioles and respiratory bronchioles. So first it is the layer of the how can you draw? First you have to draw the squamous epithelium layer, then it is connective tissue layer, then at one side. So first of all, in one side we have to draw the interpulmonary bronchiole. This is made up of the lining epithelium is pseudostratified columnar epithelium with goblet cell, and then lamina propria layer, which consists of acinis, then muscle layer, and then the hyaline cartilage layer, or we can say plates of the hyaline cartilage. This is just similar to as a trachea, which I've already seen. And then we have to draw the terminal bronchioles. This is the made up of the columnar epithelium and surrounded by the single layer or few smooth muscle layer, and the empty spaces which you can should appreciate, they are the alveoli, and this structure, the alveolary sacs, and this structure which is half is covered with the cuboidal epithelium. This layer is cuboidal epithelium layer, and there is empty space, and this is respiratory bronchiole. Here is no smooth muscle, only this lining epithelium is present. And we can also appreciate this pneumocytes, type 1 pneumocyte, which is round shape, and type 2 is a round shape, and type 1 is flattened or plate like cells, and randomly spread. There's the blood vessels, this one, these are all the blood vessels, and this is the squamous tissue epithelium. Now we look for the histological slide of the lungs. This is the histological slide of the lungs, where we should appreciate the interpulmonary bronchiole. This is the interpulmonary bronchiole. Then this free spaces. These free spaces are the alveoli. There is mainly alveoli, but we can't able to differentiate which are the respiratory bronchioles and terminal bronchioles, because haphazard majorly there is alveoli is present. These free empty spaces are alveoli. Then and pneumocytes are also present little bit. Appreciate this thin lining, the pneumocytes, type 1, type 2 pneumocytes, and majorly there is alveoli. This all are alveoli, and this is interpulmonary bronchioles. Here you can see the hyaline cartilage layer, glassy appearance of hyaline cartilage layer. Then smooth muscle layer also present little bit. So this is the histological slide of the lung, normal histological slide of the lung.